Welcome to the deep dive. Today, we're tackling something pretty specific and honestly, potentially worrying. Sudden sensorineural hearing loss.
Hmm.
You might hear it called SSNHL.
Right.
And if you're maybe looking into options, we want to take a direct look at a treatment that, well, it's maybe less common, but it's getting some attention. Hyperbaric oxygen therapy, HBOT.
Exactly. We're going to unpack what our sources say about how HBOT might actually work for SSNHL, what the thinking is behind it, and what kind of evidence is out there.
Yeah, and if you're totally new to HBOT, don't worry. We'll break it down, try and make it clear.
Absolutely. The goal here is to give you a solid understanding based on the info we've looked at.
Okay, so hyperbaric oxygen therapy, breathing pure oxygen in a pressurized chamber. Before we get to that, maybe just quickly, what exactly is sudden sensorineural hearing loss? Just so we're all on the same page.
Good point. So SSNHL is basically a rapid loss of hearing. It happens quickly, like sometimes instantly, or maybe over a couple of days. And it's not because of something obvious, like wax buildup or an ear infection. It's deeper in the hearing system. The sensorineural part points to the inner ear or the nerve pathway.
Got it. A sudden drop in hearing, inner ear related.
Hmm.
So that's the problem we're looking at. Now, the proposed solution, HBOT, what actually happens in one of those chambers?
Well, you go inside a specially designed chamber. The pressure inside is increased, usually significantly higher than the normal air pressure we experience every day.
Okay, like going deep underwater, pressure-wise.
Sort of, yeah. That's a decent analogy for the pressure aspect.
Yeah.
And while you're in there, under that increased pressure, you breathe 100% pure oxygen through a mask or a hood.
Right, not the usual 21% oxygen in the air.
Exactly, pure oxygen.
From the combination of the pressure and the pure oxygen.
Yeah.
What's the thinking there? How did that help potentially with hearing loss?
So the key is what happens to the oxygen in your blood. Normally, oxygen is mostly carried by hemoglobin in your red blood cells. But under pressure, much more oxygen can dissolve directly into the blood plasma that's the liquid part of your blood.
Ah, okay, so it's not just relying on the red blood cells.
Precisely. Think of it like a fizzy drink. The pressure keeps the gas dissolved in the liquid. HBOT uses pressure to dissolve much more oxygen directly into your blood plasma.
I see. So you've got this super oxygen-rich plasma circulating.
You got it. And the super-oxygenated blood can then potentially deliver more oxygen to all the tissues in your body, including those really delicate structures in the inner ear.
Okay, that makes sense. So why would the inner ear specifically need this extra oxygen boost in cases of sudden hearing loss? What could be going wrong that HBOT might fix?
Well, our sources suggest that sometimes SSNHL might be linked to problems with the blood supply to the inner ear. Things like maybe a tiny vascular injury or some kind of blockage. An embolic disturbance is the term used.
Like a tiny clot, maybe? Something interrupting the flow.
Could be something like that, yeah. The inner ear has these very sensitive hair cells, the sensory cells for hearing, and they need a constant good supply of oxygen and nutrients. They're metabolically very active.
And if that supply gets choked off, even a little bit.
Exactly. You can get what's called hypoxia, not enough oxygen, or
Yeah.
ischemia, not enough blood flow overall, and those sensitive cells can get damaged pretty quickly.
Right. So the idea behind HBOT is if there is some kind of blockage or reduced flow,
This extra dissolved oxygen in the plasma might be able to sneak past the blockage or just generally boost the oxygen levels in the area enough to keep those cells alive or help them recover.
okay, it's about counteracting that oxygen starvation.
That's the core theory, yes.
Yeah.
To support the recovery of those vulnerable inner ear tissues by overcoming the oxygen deficit.
Now, you mentioned these cells are sensitive and get damaged quickly. That sounds like timing would be really, really important here.
Absolutely crucial, it seems. The sources draw a parallel with a condition affecting the eye, actually. Central retinal artery occlusion, or CRAO.
Okay, what's that?
That's a sudden blockage of the main arteries supplying blood to the retina, the light-sensitive tissue at the back of the eye. Causes sudden vision loss.
Ah, so similar mechanism, sudden loss of blood flow to sensitive sensory tissue.
Exactly. And studies on CRAO show that the best chance of vision recovery happens when oxygen treatment, like HBOT, is started very quickly. We're talking ideally within hours, certainly within 24 hours.
Wow, that's a tight window.
It really is. And the retina, much like the inner ear cochlea, has these highly specialized cells that just don't tolerate oxygen deprivation well at all. So the urgency seen in CRAO strongly suggests that for SSNHL too, the sooner you can intervene with something like HBOT, the better the potential outcome.
So that urgency isn't just a guess, it's based on how similar tissues behave.
Okay.
Now, beyond the theory and the analogies, did the sources mention actual studies looking at HBOT for hearing loss?
They did, yeah. They referenced studies where HBOT was used for what's called idiopathic sudden hearing loss. That's the kind where they can't pinpoint a specific cause.
Right, the most common type, I gather?
Often, yes. And also for hearing loss caused by things like acoustic trauma, like a sudden loud blast or noise-induced hearing loss, and even for tinnitus, that ringing in the ears.
And what was the setup in those studies? Was HBOT the first thing they tried?
Interestingly, no, not always. In many of the cases mentioned, HBOT was actually brought in as a secondary therapy, meaning the patients had already tried the standard conventional treatments, usually corticosteroids, and those treatments hadn't really worked well enough. So HBOT was then added on or tried afterwards.
Okay. So even as a later option, did it seem to help? What were the results like?
The results reported were, well, pretty interesting. In about half the cases, 50%, where HBOT was started within 2 to 6 weeks after the hearing loss began.
Okay, so not immediate, but still relatively early.
Right. In that group, about half saw a marked hearing gain. That was defined as getting better by more than 20 decibels in at least 3 different sound frequencies.
And 20 decibels, is that a noticeable difference?
Oh, yeah. That can be quite significant functionally. It could mean the difference between struggling to follow a conversation and understanding it much more easily.
Okay, so half had a marked improvement. What about the others?
Then about a third, maybe 33%, showed a moderate improvement, which was defined as a gain of 10 to 20 decibels.
Still potentially helpful.
Definitely. But it's also important to note about 13% showed no improvement at all in their hearing.
Okay, so not a magic bullet, but a decent chunk saw real benefits even when other stuff hadn't worked.
That seems to be the picture painted by those specific studies, yes.
And you mentioned tinnitus earlier, the ringing. Did HBOT affect that? Tinnitus often comes along with hearing loss.
It did. And the results there were actually quite striking. Over 80% of the patients in those studies who also had tinnitus reported that the intensity of their tinnitus decreased after the HBOT sessions.
80%, that's huge.
It is quite high, yeah. Only a very small percentage found their tinnitus didn't change or got worse. So that's a potentially significant side benefit.
Definitely. Let's circle back quickly to that eye condition, the CRAO analogy, and timing. Was there anything specific reinforcing how vital prompt oxygen is?
Yes, one source highlighted a CRAO study where giving supplemental oxygen did lead to significant vision improvement, even some restoration, really underlining how much these tissues need oxygen and can potentially bounce back if they get it quickly.
Okay.
But conversely, another case was mentioned where treatment for CRAO was delayed, and they used something called carbogen. That's a mix of carbon dioxide and oxygen, and it didn't result in significant vision improvement.
So the delay was likely the key factor there.
It strongly suggests that, that the window of opportunity for these sensitive sensory tissues is potentially quite narrow. Acting fast seems paramount.
Okay, so putting it all together for someone listening who's maybe thinking about HBOT for sudden hearing loss, what are the absolute key takeaways from our sources?
Well, I'd say point number one is the timing. The effectiveness seems really linked to how quickly treatment starts after the hearing loss occurs, echoing what we see in CRAO.
Right. The sooner the better seems to be the mantra.
Definitely. Point number two is remembering that in the studies we looked at, HBOT was often a secondary treatment. So it's perhaps something to consider or discuss with your doctor if the initial standard treatments aren't giving the results you hoped for.
Okay. Good context. Now, what about safety? You know, breathing pure oxygen under pressure sounds like there could be risks.
There are potential risks, yes, and the sources do cover safety. It is a medical procedure, and like any medical procedure, it has risks that need to be managed.
What kind of risks are we talking about?
The main ones mentioned are a fire risk because of the oxygen-rich environment. Strict precautions are needed for that.
Makes sense.
Then there's barotrauma. That's injury caused by the pressure change, most commonly affecting the ears, like when you fly or dive, or potentially the sinuses.
Okay. Can that be managed?
Yes, usually by equalizing pressure, like you do on a plane. Trained staff guide patients on how to do that, and the pressure changes are done slowly and carefully.
Right. Anything else?
The other main one is oxygen toxicity. Breathing pure oxygen at a high pressure for too long can actually be harmful, potentially affecting the lungs or central nervous system.
So how is that avoided?
By strictly controlling the pressure level, the duration of each treatment session, and the total number of sessions according to established safe protocols. It's carefully calculated.
So there are established safety protocols and ways to manage these risks.
Absolutely. The sources emphasize this strongly. HBOT should only be done in proper facilities with established safety procedures, emergency plans, and crucially, qualified staff.
Qualified staffs meaning?
Meaning a medical director who's properly trained and certified in hyperbaric medicine and certified hyperbaric technologists or nurses operating the chamber and monitoring the patients. Plus, regular maintenance of the chamber itself is vital.
Okay, so definitely not something you do casually. It's a serious medical intervention requiring specialized setup.
Exactly right. Reputable facilities take safety extremely seriously.
Okay, so let's try and summarize the main message here for someone wanting to understand HBOT for sudden hearing loss. What's the bottom line from our sources?
I think the main takeaway is that HBOT seems to show potential as an adjunctive therapy, meaning something used alongside or after other treatments for SSNHL, especially, and this is key, if it's administered promptly.
And this potential is based on?
It's based on, well, the biological rationale understanding how crucial oxygen is for those inner ear cells and how HBOT dramatically increases oxygen delivery. And it's supported by the outcomes reported in some studies showing hearing gains and tinnitus improvement in a notable portion of patients, particularly those treated relatively early.
But important qualifier here.
Yes, it's really important to remember this is based on the specific sources we reviewed. Individual results will vary. It didn't work for everyone in those studies, and it's not guaranteed.
Right, so if someone listening experiences a sudden loss of hearing, what's the absolute first thing they should do? Forget HBOT for a second.
See a doctor immediately. Like, go to an ENT specialist or even the emergency room right away. Early diagnosis of SSNHL and starting conventional treatment, usually steroids, as soon as possible is widely considered critical. Don't wait.
Okay, get checked out fast. Then maybe discuss HBOT.
Then yes. Once you're under medical care, that's the time to have a conversation with your doctor about all the options, including whether HBOT might be appropriate for your specific situation, considering the timing, your overall health, and treatment availability.
Got it. And if people want to learn more generally about HBOT?
Well, they could certainly look into the broader research. As we said, it's used or being studied for various other conditions, things like diabetic foot ulcers, radiation injury, carbon monoxide poisoning. Understanding the basic principles of hyperoxygenation can give you a better context for its potential applications.
Right, good advice. Okay, that brings us towards the end of this deep dive. Time for our final thought for you, the listener.
We've talked a lot about the time-sensitive nature of treating sensory loss, like in the inner ear or the retina.
Yeah, that window seems critical. So, our question for you to ponder is this. Given that need for speed, what other emerging therapies, maybe on the cutting edge of research, might hold promise in the future for really rapid intervention and recovery for conditions like sudden hearing loss?
It's definitely an area where innovation is needed and happening. Something to think about.
Indeed. Thanks for joining us for this deep dive.